Welcome to Adapting class. IV fluids and electrolytes are usually tested over and over and over. Why? Because they form fundamental of nursing, and any mistake will affect your patient. Today, we're going to talk about IV fluid electrolyte. I'm going to give you scenarios where the NCLEX will test you, but I'm going to make it easy so that you'll be able to identify ways to answer this question and avoid trap. Let's get to it. First question, you have to know types of fluid and what each of them are for, or what is their name, which classification. How do you answer question? Read the question from the back and figure out what the question is asking. Which of the following selection by the nurse indicate a correct understanding of what? Hypotonic solution. The buzzword is what? Hypotonic solution. Underline it. A nurse has attended the staff education session about what? IV fluid. The stem of the question does not tell you anything. You can answer the question based on just the last portion of the question. So which of these is hypotonic solution? Hypotonic solution, you have to compare it to isotonic solution. You should have what? Less than 1% concentration. That's all. So which one has less than 1% concentration? Normal saline 0.9 is exactly 1%. 0.45% of normal saline is half normal. This is hypotonic solution. Infuse 5% dextrose in water. This is a good concept to know. 5% dextrose in a bottle sitting outside on your table is hypertonic. It's very hypertonic. It's like 3%. But if you infuse it in the individual, the liver breaks it down and it becomes an hypotonic solution. So infuse 5% dextrose is hypotonic solution. Lactate ringer is an isotonic solution like normal one. Therefore, that's wrong. 0.33% of normal saline is less than 1%. So this is an hypotonic solution. 3% normal saline is hypertonic solution. Therefore, which fluid selection by the nurse indicate the correct understanding of what? Hypotonic solution. Therefore, number 2 is hypotonic. Number 3 is an hypotonic when it is infused. Lactate ringer is isotonic. 0.33% is hypotonic solution, and 3% normal saline is hypertonic solution. 2, 3, and 5 are your right answer. Answer this question to show you how all the questions would be. So the next one, you stop the video, 10 seconds, answer the question, then put it on and see the way I'm going to approach it. We learn test-taking strategy using NCLEX questions and answers for IV fluid and electrolytes. Fundamentals of fluid and electrolyte. Which of the following finding is most concerning and require immediate action? That means bad things. Therefore, underline most concerning. And let's care for a client with a history of what? CHF and diabetes, right? The client is currently taking bumetanide and metformin. Those are my buzzwords. Underline them. What are my buzzwords? Metformin and bumetanide. The next one is most concerning. Connect the dots. Find what is metformin and bumetanide. And look at the answer. Blood glucose of 156, numbness and tingling of the leg, weight loss of 2 pounds over 3 days, bilateral what? Fetal edema. Which one should concern you? Patient has CHF and diabetes. Metformin is for diabetes. Bumetanide is for CHF. Why do I give you bumetanide? It's a loop diuretic. It's going to get rid of your fluid, right? Test-taking strategy. Therefore, it's a loop diuretic. What can you see in the question? What do you think? Stop the video, answer it. But if you answer it, this is the way you should approach it. Blood glucose of 156, where the patient has diabetes, metformin will take care of it. Should I worry about it? It's not too high. Numbness and tingling of the leg is related to electrolyte problem. Which of these will cause electrolyte problem? Bumetanide. What does it cause? It's a loop diuretic. What electrolyte issue does it cause? Hypokalemia. Does this represent hypokalemia? Weight loss of 2 pounds over 3 days. CHF patient losing weight, that's good. They may be dehydrated, but there is nothing telling you that they dehydrated. All they say is lose pound. That means they lost fluid. It's good. It will help with the heart failure. Bilateral leg and pedal is mild. I'm not going to be worried about it. Therefore, numbness and tingling of the leg, it means what? Hypokalemia. Sometimes they will give you muscle cramp. The best way to know is neurological symptoms, muscle cramps, paresthesias, and other things are associated with what? Hypokalemia. Therefore, patient on bumetanide for CHF with the numbness and tingliness of the leg, I'm worried. This is hypokalemia symptoms, and that's the one I'm going to pick. Test taking strategy, critical thinking, fluid and electrolyte way, English questions and answers, using this to teach you how to approach them. Scenario, right? Which findings require immediate intervention? That means bad things, right? And next is assessing a client after thyroidectomy. Ask yourself, what is thyroidectomy? The thyroidectomy means removal of your thyroid. What is the number one side effect after removal of your thyroid? Your calcium goes down. Which of these answer choice tell you my calcium is going down? You see, I'll break it down, bring my content, going to use it. Tingling around the mouth. Oh, calcium is down. Positive trousseau sign. Oh, calcium is down. Heart rate of 104. Yeah, calcium is down. Laryngeal spasm. Calcium is down. But which of these calcium down is more dangerous? Airway, airway, airway. Number 4 is laryngeal spasm. You know, if only having numbness and tingliness on your mouth or your lips, or when they put a blood pressure cuff around your forearm, they have spasm. This one, your airway muscles are having spasm. I'll pick number 4. Which action should the nurse take prior to initiating the transfusion? What would you do first? The nurse prepared to administer what? PRBC, blood, to a client. The client is receiving what? 20 and 5% dextrose in water through 20 gauge peripheral IV. What would you do before you give it to the patient? Break it down. You have a patient, you need blood, but already having some fluid going. D5W, 220 gauge in it. Every time you see questions like that, you know what they're going to ask you. You can tell that they're trying to track and trap you. Can I infuse blood transfusion through a D5W port or through 20 gauge needle? That's all. Therefore, once they give the blood through the same IV while the D5W is going. This is wrong. You can't run both at the same time. You can't run D5 through the blood. There's a specific blood that a fluid you need to run blood. And that is what? Normal saline. Flush the IV line with what? Sterile water before starting the what? The transfusion. Once again, D5W almost close to what? Water. But it doesn't have, sterile water does not have sugar in it. Stop the D5W, flush the line with normal saline before hanging the blood. Yeah, you stop the D5W, now you prime the tube with normal saline. That is the fluid needed to run blood transfusion and hang the blood. That means we think the 20 gauge is enough. Start a new IV using 16 gauge needle for blood transfusion. 16 gauge needle is good. It's big. Blood can go through there, but there's no indication. Test taking strategy. 20 gauge is enough for blood transfusions. Therefore, you don't need to place a new one. This is the way I want you to think about the question and think about it well. Therefore, 3 is enough. Which client is at highest risk of developing what? Hypokalemia. That's the buzzword, hypokalemia. And nurse is caring for 4 clients who develop hypokalemia. You have to know conditions that would lead to hypokalemia. Stop the video, answer the question, put down in the comment section, tell me how you do, and I'll reply. But what is the problem? Patient receiving IV spironolactone for CHF. Do you think it will cause hypokalemia? Client, he has burned about 45%, third-degree burn to the body. Would this cause hypokalemia? He's diagnosed with what? SIADH. Do you think we're going to have hypokalemia? The client receiving high dose of albuterol for asthma attack. Break it down. Don't worry, I got you. Spironolactone is potassium sparing. Just by using my content, I know I can eliminate it. If you have burn wound, think about it, your cells will burst open. All your potassium in the cell will go outside. Therefore, you have hyperkalemia. 2 is gone. And I know SIDH has nothing to do with potassium. It's mostly sodium. Therefore, test the king strategy. I don't know what number 4 is, but I got to pick it and move on. I'll give you the explanation. Albuterol is a beta agonist. It causes hypokalemia, one of the side effects. Therefore, number 4 is the right answer. All beta agonists will do that. Which intervention does the nurse anticipate? What would you do? A nurse care for a client with what? Small cell lung cancer and SIDH. They've told you SIDH coming from small cell lung cancer. Then stop. Think about it. What is the content regarding SIDH? That means you have too much ADH and you hold on to water. And therefore, what do you have? Dilutional hyponatremia. All the water will dilute your sodium. You gain weight. Your urine specific gravity is going to go high. Therefore, which intervention does the nurse anticipate? Vasopressin IV infusion, 0.9% normal saline, initiate fluid restriction, administer D5W. Test taking strategy. Think about it. I've already given you the answer in a very small way. SIDH is because you have too much ADH. You hold on to water, and therefore you dilute your sodium. You gain weight. You are fluid overloaded. If you don't do anything, hyponatremia can lead to seizures. Now, what would you do? You have too much fluid. Should I give you fluid? No. Yes. It's both no and yes. What does that mean? I can give you fluid, but I have to give you fluid that will correct your sodium. 29% will not correct your sodium. You need 3%. Number 2 is gone. Number 4, you need hypertonic saline. 3% is better. D5W is going to worsen the hyponatremia. Vasopressin is the same thing as ADH. Why would I give you more? You can see number 3 is sitting there, popping out like a candy. He said, pick me. Therefore, initiate fluid restriction. NCLEX practice questions and answers, fluid electrolyte to master this content, make fundamentals of nursing easy. So this is fluid fundamentals. A client with what? Prolonged NG tube suctioning become what? Lethargic and confused. Which electrolyte imbalance does the nurse suspect? Think about it. Let's think about it. This is your stomach. You have NG tube there. What is NG tube sucking? Suck fluid. Most of this fluid is acid. If I suck all the acid, I'll be left with the base. Therefore, I know your electrolyte has to be a base. I take all your sodium goes down. What is going to happen to your potassium? It goes down because the kidney would take sodium over potassium. So you have hypokalemia, hypokalemic, hyponatremic, metabolic alkalosis, and low chloride. Therefore, what do you see? Hyper, I take it off. Hyper, I take it off. I don't have acidosis, I will have alkalosis. So hyponatremia, hypokalemia, hypochloric, metabolic alkalosis. 4 is your answer. How many answers have you got so far? We are number 8. 2 more. I know you get 7 out of 7. Let's get number 8 out of 8, right? And let's inject what? 50 milliequivalent of potassium chloride into 250 ml bag of normal saline. What is the next action? This is complete fluid fundamentals. You have to know how to prepare potassium, and you have to know how to give it to the patient. What should the nurse do first? Request a second nurse to witness the bag before hanging the fluid and give it to the infusing the potassium. Spike the bag and begin infusing at the prescribed rate. Invert the bag several times. Label the IV tubing as what? Potassium infusion high alert. This question I want everybody to try. If you watch this video and you get to this place, please put the comments and let me know what you think. What was your thinking? Which answer choice you pick? And why did you pick it? And explain yourself. But then you can listen to the way I approach it. Look, this is the principles of potassium preparation. It's a high maintenance medication, so they follow certain protocol. When they give you the prescribed 50 milli equivalent of potassium, you add it to the 250, you're going to infuse. After you inject it, the next thing you got to make sure the medication mixes so that you don't give the patient a bolus. So you got to roll it back and forth, invert it several times so that it is completely mixed. You don't need a second nurse to witness it. You are the nurse. You will spike the bag, but not after you have infused it. Of course, you're going to label it, but not after you have made sure everything is complete and mixed. So 3 is your answer. The next question is to illustrate all the steps as a teaching. So if you don't know the steps, because this is what showed up, and this is the way it was done. So pay attention. This is the way they can ask you about potassium because it's a high maintenance medication. Therefore, this is a teaching. I'm going to teach you how to prepare potassium and then prepare to administer potassium IV to a client. What is the correct order steps for a safe medication administration? What is the safe medication administration? Potassium coming, you got to prepare it and then infuse it to the patient. What do you think? The first thing you should do is withdraw the IV bag from the IV pole, right? That's the number 1. Number 2, they inject the prescribed amount of potassium into the bag. If it's 250 or a liter, most of the time it's small dose. Then mix it so that it's completely mixed. Invert gently. That will agitate the IV bag several times so that it doesn't get concentrated. After that, label it so that we know it's a high maintenance medication. Label it after you've mixed it. Then you prime the tube. Begin your infusion through what? A pump, not a bolus, and monitor the client. These 7 steps, please know it for any high maintenance medication. It's the fundamentals of IV fluid, line placement, and you got to get it. So the order is correct. And the last one. This is the other question to teach you. I've already answered this one, but that is the way you can figure out. Which of the following IV fluid should the nurse anticipate prescribed? In this care for a client experiencing hemorrhagic shock. What fluid would you give this patient? Think about it. Shock is hypoperfusion. That means they're losing blood somewhere, or they lose fluid somewhere, or the blood pressure is low and they're tachycardic. What fluid will you give to a patient who has hemorrhagic fluid? Shock. You give them back the fluid. What fluid would you choose? You're going to pick a fluid that is going to keep the concentration of plasma the same. Give fluid that will keep concentration of plasma the same. What is the concentration of plasma? 1% or 0.9%. Which of these is 1% or 0.9%? Number 1, normal saline, 0.9%. Half normal, 0.45 is not appropriate for resuscitation. 5% dextrose is just pure water. It's not good. D5LR is good, right? It has dextrose in it, but it also is a lactate ringer. You can give it to the patient. You give them a sugar and then the lactate ringer. 0.33% normal saline is hypotonic. And the 3% normal saline is too much. Hypertonic. It's not resuscitative. It's used to pull fluid. What are your answers? 1 and 4. Thank you for watching Fluid and Electrolyte, NCLEX questions and answers, fundamental of nursing, test taking strategy to master this NCLEX and nursing school topic that trip people. I know you got it. If you like more, check out Dante at NCLEX, subscribe for more content like that, and put your notification on so that when I make a video, YouTube will remind you. Take care and have a good day.